Hello friends, my name is Dr. Arpit Kaliya and I welcome you all on my YouTube channel Right Academy, the home of success, right? So yes, I am making this video after a very long time. Yes, I am currently a resident doctor, second year resident doctor in Department of General Surgery at BJ Medical College, Ahmedabad, right? So today I am going to discuss about the approach to the breast lump. When some patient came to you in OPD or emergency department with complaint of swelling in breast, then how will you proceed further? How should you proceed further for the investigation and management of that patient, right? So today we will going to discuss about that, right? Yes. So today we will discuss about the approach to breast lump. Approach to breast lump, right? When some patient came to you in OPD or emergency department with complaint of swelling in breast, then how should you proceed further, right? We'll discuss about that. So what is our aim? If patient came to you with complaint of breast lump, then our aim should be only single. We should have single aim, right? Our aim is to rule out any malignant pathology, right? Which is a big concern for a female with a complaint of breast lump, right? Whether it is malignant or benign, we have to rule out. We have to rule out that condition, right, and proceed further. So our aim is to rule out breast malignancy, right? Our aim is to rule out the breast malignancy, right? So we'll proceed by first of all, we'll clinically examine the patient. We'll take history of the patient, which is a very important. Since how long she has a complaint of swelling in breast? Is it painless? Is it any redness over the swelling? Yes. Is it mobile? Is there any nipple discharge? What is the age of menarche? Yes. Parity, about the parity of the patient we'll ask about, right? We'll ask about the breastfeeding techniques, right? We'll ask about the any family history, any significant family history. Is there any first degree or second degree relative in family, right? We'll ask about all this thing. Yes, we'll ask about all this history to the patient, right? After history taking, we'll proceed further for examination. अब यहाँ पे एग्जामिनेशन दो तरह के होते हैं. एक होता है सेल्फ ब्रेस्ट एग्जामिनेशन, एक होता है एग्जामिनेशन ऑफ ब्रेस्ट बाय क्लिनिशियन. सो हियर वी आर टॉकिंग अबाउट द एग्जामिनेशन ऑफ ब्रेस्ट बाय क्लिनिशियन. हम जो ओपीडी में या इमरजेंसी में ब्रेस्ट का एग्जामिनेशन करते हैं, क्लिनिकल एग्जामिनेशन, उसके बारे में हम यहाँ बात करेंगे, ठीक है. जो सेल्फ ब्रेस्ट एग्जामिनेशन होता है वो पूरा कंसेप्ट अलग है, ठीक है. हम यहाँ पे उसकी बात नहीं कर रहे हैं, ठीक है. वी आर टॉकिंग अबाउट द clinician breast examination, right? Examination of breast done by clinician, right? So there are three techniques of examination of breast, right? Here we'll discuss about that, the techniques of breast examination, right? The one is circular method of breast examination. We'll start from center of breast. We'll start, suppose this is a breast, right? We'll start from center and we'll move towards the periphery, right? This is a circular method of breast examination. This is called a circular method of breast examination, right? So this is a circular method of breast examination. We'll start in center and we'll go anti-clockwise, right? We'll go anti-clockwise towards the periphery, right? Towards the periphery. We'll go towards periphery, right? Start from center and go towards the periphery. It is called circular method of breast examination, right? It is called circular method of breast examination, right? The next method is vertical stripes method. In this, suppose this is a breast, we'll start from one quadrant and move towards the other quadrant of breast, right? Suppose we'll start from the medial side of quadrants, then we'll go towards outwards like this, just like this, just like this, just like this. We'll start from medial side and end towards lateral side, right? if we start from upper quadrants, then we'll move towards the lower quadrant, right? Just like this, just like this. This method is called a vertical strives method of breast examination. This method is called vertical strives method of breast examination, right? The third method is third method, which is explained by the AIMS New Delhi, right? And it was asked in the AIMS examination also. So which is this method? This method is dial clock method, right? Dial clock method. We'll talk about the dial clock method, right? Suppose this is breast, and assume that it is like a dial of clock, right? It is here 12, 3, 6 and 9, right? So assume breast as a dial of clock, and we will start from the periphery and move towards the center, right? Move towards the nipple areola complex. You will start at periphery, you will start palpation at periphery of breast and move towards the nipple areola complex or center of the breast, right? Just like that. Here you will start from the 12 o'clock and move towards the, you will start pressing and move towards the center, right? Here 1 o'clock, 2 o'clock, right? Here 3 o'clock, 6 o'clock, and just like that 9 o'clock. We will start from periphery and move towards the center, right? This method is called a dial clock method of breast examination, right? Dial clock method of breast examination. This question was asked previously many times in AIMS exam, INI set exam, right? This is asked many times. Now this was the examination part. After examination, you have to prove that which type of this swelling is, right? Is this is malignant or is this is benign swelling, right? You have to prove that. For that, you have to go for a tissue diagnosis. Tissue diagnosis means by FNAC or by a true cut biopsy. For that, you have to localize the pathology. If there is a swelling, you have swelling in breast, on palpation you have swelling in breast, but you have to localize the swelling by a radiological examination first, and then you should go for a histological examination to prove whether this is a benign or a malignant swelling, right? So first line investigation for a breast lump is a radiology. Always radiology. First line investigation is always radiology, but the gold standard investigation is, or gold standard or investigation of choice is histological examination, because this is giving you a proof that this swelling is not benign or not a malignant swelling. Yes, so this is an investigation of choice to prove that, to move further towards the surgical exploration of the particular swelling, right? This give you a tissue diagnosis. That's why it is an investigation of choice or gold standard investigation for the breast lump. But the first investigation is a radiology, right? But here the aim of radiological investigation is only localization of pathology for a histological examination. You cannot say confirmatively that this swelling is benign or malignant based on radiological investigation, right? You have to go for a tissue diagnosis for that. So the radiological investigation, the aim of radiological investigation is only localization of pathology, right? Only aim is localization of pathology. You cannot surely say whether this swelling is benign or malignant based on radiological investigation, right? Yes. So in radiology we have two investigation. One is USG, other is mammography. But in which patient you should go for a USG and in which patient you should go for a mammography? Is there any criteria? Yes, there is a criteria of age. In younger patient, age less than 35 years of age, will go for a ultrasonography. In age younger than 35 years of age, will go for ultrasonography, right? Ultrasonography. But if the age is more than 35 year, then we should go for a mammography, right? We'll go for a mammography. So अब ये क्वेश्चन आता है कि वाई वी कैन नॉट डू अ मेमोग्राफी इन एज यंगर देन 35 year of age, और इन younger patient why we can't do mammography? Yeah, the answer is because the density of breast, because the breast is continuously going in involution, regression. So there is a due to this there is a fibrotic changes in breast. Yes, breast will continuously going in hormonal changes, right? So due to that there is a continuous regression. So that's why there is a fibrosis. It changes the density of breast, and it give a false positive or a false negative result by the mammography in younger patient, right? Near the age of 35, many patient will go towards the menopause, right? Menopause around 40-45 years. Mean age of menopause is 45 years, right? So this more than 35 year of age is nearer to the menopause of a particular female. So that's why there is a less chances of the fibrotic so the density of the breast is inversely proportional to the quality of the image. The quality of the image is inversely proportional to the density of the breast. So in young patient there is a more dense breast, the quality of the image is poor, and as the patient grows older, then the breast becomes less dense, so the quality of the image is better than the younger one, right? So that's why if the patient age is less than 35 year of the age, we should go for ultrasonography or mammosonogram, right? And if the age is if the patient's age is more than 35 year of the age, then you should go for a mammography, right? You should go for mammography, right? After this you have localized the pathology, then you have to go for a tissue diagnosis. So in tissue diagnosis we should go for a FNAC or true cut biopsy, core needle biopsy. We should go for that, right? So let's discuss about that. So before discussing about the true cut and the FNAC, let's understand this BI-RADS category. This is based on the mammographic finding, right? This is based on the mammographic finding. BI-RADS. Right? So there are 7 categories in BI-RADS. So it starts from 0, 1, 2, 3, 4, 5, 6. So this 6 category, this is the definition of BI-RADS category, and here is the risk of malignancy, likelihood of malignancy in percentage for particular BI-RADS category. Okay, this is that. So BI-RADS 0 is its definition is it's incomplete study or need other imaging evaluation. It's need other imaging evaluation, right? It's need other imaging, incomplete study and need other imaging evaluation, right? In BI-RADS 1 it is negative and it's a normal breast, absolutely normal breast. There is no risk of malignancy. 0%, right? 0% risk, 0%. There is no risk of malignancy, right? In BI-RADS 2 there is a benign finding, no need for further correlation, and here also there is a 0% risk of malignancy, right? 0% risk of malignancy. In BI-RADS 3 it is a probably benign swelling, but it can be malignant. So here you should advise the patient strict short-term follow-up of a radiological investigation. You have to do mammography every 6 monthly for this patient particularly, right? Short interval follow-up is advised to this patient because there is a likelihood chance of malignancy in less than 2%. Yes, there are chances in 2% of patient there can be a malignancy in BI-RADS 3 category, right? So you should advise the patient to that she should go for a mammogram every 6 monthly for at least 2 years, right? For at least 2 years, and then but here you can go for a histological investigation also. You should go for histological examination in patient with BIRADS 3 category, right? In patient with BIRADS 3 you should go for histological examination. In BIRADS 1 and 2 there is no necessity to go for histological examination, because the likelihood of the chance of malignancy is 0%, right? But in BIRADS 3 there is chance, less than 2% chance. It's a big chance. So you have to go for a biopsy, or like FNA or true cut biopsy, right? You have to go for histological diagnosis in this patient, and strict follow up of MRI, mammosonogram, strict follow up with mammography, right? You should advise patient strict follow up of mammography every 6 monthly, and you should go for a histological investigation in this BIRADS 3 category, right? BIRADS 3 category, right? BIRADS 4, it's a suspicion of suspicious finding. It can be malignant. There is a high chance of malignant land. BIRADS 3, yes, you must go for biopsy, because there is likelihood of malignancy. There are 3 categories in BIRADS 4, 4A, 4B and 4C, and there are likelihood of chance of malignancy up to the 95%. 4A, there are low suspicion of malignancy greater than 2% but less than equal to 10%, right? And 4B, there is a moderate suspicion for malignancy greater than 10% to less than equal to 50%, right? In 4C, there is a high suspicion of malignancy more than 50% to less than 95%, right? In BIRADS 5, what is there in BIRADS 5? It is a highly suggestive, not suspicious, it's highly suggestive of malignancy. You should go for a surgical intervention in this patient. So BIRADS 5, it's a highly suggestive of malignancy, and you have to go for a surgical intervention in this patient, right? You should go for surgical intervention in this patient, yes. And there are likelihood of malignancy is 95%, more than 95%, yes, more than equal to 95%. The BIRADS 6, it is a biopsy proven malignancy. You have to go for a surgical intervention in this patient. Right? So this is all about the BIRADS. So the catch here is you have to go for a histological investigation in patients with BIRADS 3. You have to go for a histological investigation in patient with BIRADS 3. Yes, if there is a BIRADS 3, you should advise the patient for every 6 month mammogram, and you should go for biopsy. You should go for a biopsy, right? Right? So this is a catch here, right? You should go for biopsy in this patient, because the chance of malignancy is less than equal to 2%, which is a very significant number, right? So this is all about the BIRADS. Now we'll talk about the true cut and FNAC, right? Histological investigation in patient with breast lump. Now we'll talk about that, the histology, right? We'll talk about the histology. So there are 2 investigations. One is FNAC and one is true cut biopsy or core needle biopsy. Yes. So the FNAC, we'll talk about the FNAC here. FNAC, we use a 22 gauge needle. 22 gauge needle is used, and the breast tissue is aspirated. Whatever tissue came in the syringe, then by that you have to prepare the slides and go for a breast tissue cytology. But here the amount of tissue is very less. Yes, here the amount of tissue is very less. So it is not a confirmatory, and it can tell you that this investigation, this FNA can tell you whether this swelling is benign or malignant. Yes, it can tell you whether it is benign or malignant. Yes, it can tell you, but and true cut also can tell you, but there is a difference in invasiveness and non-invasiveness. This FNAC can't tell you about the invasiveness of the swelling, whether this is a, if it is a tumor, then it is invasive or not. It can't tell about invasiveness. Whether this is going to invade the basement membrane or not, this FNAC can't tell this, right? Then for that reason the true cut biopsy is the investigation of choice, for the breast lump, because the aim of treating the patient with breast lump is to rule out the malignancy, and for that only true cut biopsy can tell you that this swelling is not malignant, this is a benign. So that's why it is a investigation of choice. Right? Because here we are using 16 gauge needle. Here we are using a 16 gauge needle, which is a very big needle. It is a very big needle than 22 gauge. Here we are using 16 gauge needle. So here the chunk of tissue is more. So that's why it can tell you whether it is going to spread towards the skin or not, or it can also tell you whether it is going to invade the basement membrane or not, right? So it will give you a big chunk of tissue. So that's why it is more accurate than FNAC, because in FNAC there is a minute amount of tissue is there in syringe, and by that you will going to prepare 6 slides. Yes, so that cannot tell you, that cannot give you a confirmed report that whether it is invasive or non-invasive. So for that, invasiveness can be told by a true cut biopsy, not FNAC. So this is the very important. Invasiveness is told by the true cut biopsy and not FNAC. So here we'll quote this directly from Sabitson. This is a picture from Sabitson. So here it is written that fine needle aspiration cytology. Fine needle aspiration, we use a 22 gauge needle, right? Yes. Here is the limit. Here it is given the limitation of the FNAC. Limitation of FNA in evaluating the solid mass in the cytological evaluation does not differentiate invasiveness, non-invasive lesion from the invasive lesion if malignant cells are identified. Yes, यही तो हमने बताया था कि invasiveness it cannot be tell by the FNAC, and if FNA, if FNA demonstrate a malignancy, a core needle biopsy is still required for a definitive histological diagnosis before proceeding towards the surgery. Yes, अगर हमें FNAC के अंदर malignancy की कुछ भी ऐसा पॉजिटिव आता है कि yes this swelling is malignant, then you must go for a true cut biopsy before proceeding towards the surgery, right? So this is the limitation of the FNAC, right? This is the limitation of the FNAC. Yes, in patient with the breast malignancy, right? So in this case the FNA can be used to determine if the second lesion is malignant and confirm a diagnosis of malignant breast cancer. The information can aid in determining the appropriate surgical plan, right? And the FNAC is also used in the evaluating the lymph node status of the patient. If a patient came to you with a breast lump and it is a proven malignancy and there is also a lymph node present, then you have to tell whether there is a metastatic lymph node or it is an inflammatory or just a normal swollen lymph node, right? So you can tell that about the by use of FNAC. Yes, FNAC can tell you whether this lymph node is a metastatic lymph node or just an inflammatory lymph node. So because the whole protocol will going to change if the lymph node is metastatic. Then if lymph node is metastatic, then you have to go for a modified radical mastectomy. And if there is no lymph node, or lymph node is an inflammatory or simple lymph node, then you can go for a simple mastectomy or a breast conservative surgery, right? So the whole protocol is going to change based on the lymph node status, because it is a prognostic factor in breast cancer patient, right? So here it is. FNA is commonly used. FNA is commonly used in the evaluation of lymph node that are suspicious on either physical examination or imaging, particularly high resolution ultrasonography of the regional nodal veins, right? The suspicious lymph node can be evaluated by FNA to determine whether the metastatic disease is present or not, right? There are very high sensitivity of the FNAC. Sensitivity is approximately 90% and specificity is up to the 100%. It is a highly specific. Yes, determining whether the tumor has spread to the regional lymph node is an important step in the initial staging of the breast cancer that provides the prognostic information and helps determine the appropriate management strategy, right? So here FNAC is very useful. So but let's discuss about one scenario. We are telling, see, suppose you have got done a true cut biopsy. आपने ट्रू कट करवा लिया, बट ये इनकंक्लूसिव आया, देन नेगेटिव आया और इनकंक्लूसिव आया, देन आप क्या करोगे? यू हैव टू रिपीट द ट्रू कट. रिपीट ट्रू कट. Yes, if this is also negative or inconclusive, but you are clinically highly suspicious of a malignant lesion, then you should go for a excision biopsy. Excision biopsy, which is a gold standard investigation for a breast pathology. Yes, gold standard. Yes, this is a gold standard investigation for breast pathology. Any breast pathology, gold standard investigation, right? So this is all about the approach to the breast cancer. Hope you enjoyed this video. Yes, bye bye. Thank you so much.